Hi everyone, I'm going to be doing my project on multiple sclerosis. Multiple sclerosis, commonly referred to as MS, is actually an immune-mediated progressive disease. It's a disease process which occurs as a result of the demyelination of CNS and spinal cord nerve fibers. Demyelination refers to the destruction of the myelin sheath. Myelin is the fatty, proteinaceous material which surrounds nerve fibers in the brain and spinal cord. This results in an interruption of nerve impulses. This disease can occur at any age, but is most often seen in those between the ages of 20 and 40. It affects women more than men, and there is an increased risk in Caucasians of Northern European ancestry. The exact etiology is unknown, however, it is thought to result from multiple factors and their interactions. This includes the individual's environment as well as genetic susceptibility. The combination of these factors triggers the immune response, which results in the damage of myelin sheath, oligodendrocytes, axons, and neurons. In a normal functioning brain, sensitized T cells are able to cross the blood-brain barrier to check the CNS for antigens. During this time, B cells and monocytes are also activated, and B cells secrete antibodies against myelin. The T cells then leave the brain. However, in a person affected by MS, the sensitized T cells remain in the CNS and promote the infiltration of other agents, which cause damage to the immune system. The immune system reacts by attacking, which results in inflammation that damages myelin as well as the oligodendroglial cells, which actually produce myelin in the CNS. The myelin, whose function is to insulate the axon and increase the speed of impulse conduction along the axon, are now damaged. Results of demyelination include an interrupted flow of nerve impulse, plaques which appear on demyelinated axons, further causing interruption, and eventually leading to axon degeneration. The demyelination of specific nerves is the cause of the clinical manifestations of the disease. That is to say, clinical manifestations that occur, for example vision loss, are a result of demyelination in that specific area. Most commonly affected areas include the optic nerves, chiasm, and spinal cord. Once axons actually begin to degenerate, permanent and irreversible damage results. There are two main forms of MS, relapsing remitting course and primary progressive course. Approximately 85 to 90% of patients with MS have the relapsing remitting course, and this means they experience periods of symptom exacerbation followed by usually complete recovery. However, it is important to note that over time, residual deficits may occur and accumulate. This may result in functional decline over time. Primary progressive MS is characterized by continually increasing occurrence of disabling symptoms without periods of recovery. It may result in quadriparesis, cognitive dysfunction, visual loss, and brainstem syndromes. Presenting syndromes depend on the location of the plaques or combination lesions on the nerves. Most commonly reported symptoms include unilateral visual loss, loss of balance, and difficulty with coordination, pain, limb numbness, especially in the legs, depression, fatigue that is typically worse in the afternoon hours, and general weakness. Both pain and fatigue can be socially isolating symptoms for the patient with MS, so it is important to keep your patient's emotional well-being in mind. There are many additional sensory manifestations of MS, which include paresthesias, dysthesias, which is unpleasant or abnormal sense of touch, and a loss of proprioception or directional balance. More severe symptoms of MS include spasticity of the extremities. Spasticity results in muscle hypertonicity and can result in gait abnormalities and are often painful. Ataxia is the impaired coordination of movements, which may also contribute to gait abnormalities or tremors. It is indicative of damage to the cerebellum or basal ganglia. Bladder and bowel dysfunction may result, as well as difficulty following or dysphagia and sexual dysfunction. During your assessment, it's really important to pay attention to your patient's history of symptoms. It's important to see how their illness is progressing, as well as any current medications they may be taking and how well they're adhering to their current medication schedule. If there are any community resources being utilized by the patient, such as transport or group therapy, it is important to gather that information as well. Assessing any additional health problems the patient may have, as well as any types of treatment that are being received, are also important. Important components of your physical assessment are to assess for the presence of dysphagia or difficulty swallowing, as well as speech disturbances. It's important to assess for any loss of vision, visual difficulties, gait disturbances, or tremors. Unusual fatigue, weakness, and clumsiness, as well as numbness in the extremities or on one side of the face, are important to assess for. And lastly, it's important to assess for bladder and bowel control, as this is often an issue in patients with MS. In those with relapse remitting MS, diagnosis is typically based on the pattern of symptoms exhibited by the patient. MRI may be useful as well to reveal areas of the lesions in the brain and spinal cord, as well as CT scan, which can show areas of increased white matter density. Lumbar puncture is typically used in those with primary progressive course of MS whose symptoms may be less straightforward. And on the cerebral spinal fluid, they do electrophoresis, which may show presence of illegal clonal or IgG bands, which is indicative of MS. So I thought it would be important to include some common nursing diagnoses that are associated with MS. This includes impaired physical mobility related to fatigue related to impaired home maintenance related to and impaired urinary elimination related to. Currently, no curative measures exist for MS. The goals of treatment are to treat the acute exacerbations, delay progression of the disease, manage chronic symptoms, and this is accompanied by or accomplished by pharmacological therapy and symptom management. Included in symptom management is the promotion of physical mobility through exercise and stretching to aid in minimizing spasticity and contracture. Activity and rest are important as well as minimizing effects of immobility through range of motion exercises. It is important to assess any motor or sensory dysfunction these patients may be experiencing to properly aid in preventing injury. Pharmacological therapy is very important in the management of MS. Disease-modifying therapies are those utilized to not only reduce the frequency of relapse, but also the duration of relapse, as well as the size and number of plaques observable by MRI. Medications included in this are interferon beta 1A and interferon beta 1B, which are administered sub-Q. Another preparation of interferon beta 1A, Avonex, is to be administered once a week intramuscularly. Glutamine acetate, administered sub-Q daily, and is known to reduce the number of plaques, increase the time between relapses, and reduce the rate of relapse. IV methylprednisolone is important in treating acute relapses and shortens the duration of the relapse. Many other medications may be administered to help manage symptoms of MS, but these are vary depending on the symptoms the patient is currently exhibiting. There are a variety of nursing interventions that can be utilized in the patient with MS. It's very important to encourage self-care as well as frequent periods of rest. Because dysphagia is a common issue in patients with MS, it's important to prevent aspiration by having suction apparatus ready at the bedside and ensure proper positioning for eating. With exercise, it's important to encourage your patients to work till the point they are close to fatigue but not fully fatigued. It's a fine balance. It's important to promote relaxation and coordination exercises as well as resistance exercises to help promote muscle efficiency and muscle strength. It's important to encourage your patient to ambulate regularly and implement a voiding schedule every 1.5 to 2 hours to enhance bladder and bowel control. In patients with MS, visual disturbances are common, so it's important to assess for those and accommodate. An example of this would be to use an eye patch on one eye for patients who have diplopia or double vision, because this can help to focus their vision. You want to make sure to be providing emotional support for patients as well as their families during these times, especially during exacerbations, as this can be very stressful. You want to make sure you're administering the medications as prescribed and assessing patients' coping mechanisms. It's important to introduce things which may improve the patient's home management of MS, such as assistive eating devices, and refer your patient to any home health care services for which they are eligible. A few desired patient outcomes are that the patient will report improvement in energy levels and be able to identify risk factors which affect/trigger fatigue. Patients will adhere to their medication regimen, and the patient will utilize proper assistive devices to enhance their management of the disease at home. And lastly, your patient will engage in their exercise program, physical therapy, and rehabilitation included. Taking an in-depth look at multiple sclerosis has been helpful in many ways. It enhanced my knowledge of the disease tenfold. I had no idea there were so many dimensions to this disease, and now understanding that, I will be able to have a better understanding of it in my future patients. I also learned that there may be a heavy emotional toll on not only the patient but their family. To care for these patients holistically, it is important to assess such factors as well as other areas of their life that are being impacted. I feel like my assessment skills have been bettered by researching this complex disease. Thank you.